Hello, good evening and welcome back to my channel. My today's topic is mycotic corneal ulcer. Mycotic, we can sense it is caused by the fungi. So this is defined as it is a suppurative corneal ulcer caused by fungi. Mycotic corneal ulcer, it shows like a grayish white appearance as you can see in the picture. Then next it is the etiology. In etiology, first is the fungi itself, and it can be many types. First is the filamentous fungi, second yeast, and the third is the dimorphic fungi. These all three can causes the mycotic corneal ulcer. Then the second etiology, it is a mode of infection. In that, first is the injury of vegetative materials such as crop, leaf, or tree, straw, and the thorn, wooden stick, etc. Second mode of infection can be injury caused by the animal tail and the secondary fungal ulcers, which is common in the immunosuppressive patients. Then the third etiological factor can be overuse of antibiotic and steroids. Now the clinical features. In that, first comes symptoms. In symptoms, first is the ocular pain, watering of the eye. Third, photophobia can be seen, and fourth is the blurred vision. It is the most common symptom. Now the signs of the disease, there is a sign, it is more prominent than the symptoms. In that, first we can see the corneal ulcer, which is grayish white, dry looking. Pigmented ulcer may be also caused by some species of fungi. Then the delicate feathery finger like extensions are present around the stroma. Then sterile immune rings like yellow line demarcation may be also present. Then next, multiple and small stellate lesions may be present around the ulcer. Then the next sign of the disease is the first is the endothelial plaque are present everywhere in the ocular area. Next is the perforation, and the corneal vascularization is rare or absent. Then next, the diagnosis. In that diagnosis, first is the clinical diagnosis. In clinical diagnosis, first is the typical clinical manifestation. In that, vegetative materials are highly suspicious. Second is the chronic ulcer worsening, and third is the confocal microscopic examination of the cornea. These all three are mentioned in the clinical diagnosis, which are important. Then the next diagnosis, it is about the laboratory investigation. First, it is done by the corneal scraping, and corneal scraping, it should be performed under the topical anesthesia from the base and the leading edges of the ulcer. Then lastly, the treatment. In that, first is a topical antifungal eye drop is given, and that amphotericin B and the nystatin can be given. Then the second treatment, it can be the systemic antifungal drugs like fluconazole, ketoconazole, and voriconazole. Then the third treatment is the adjuvant and the concurrent therapy. Non-specific treatment or general measures are similar to the bacterial corneal ulcer. Then lastly, the therapeutic penetrating keratoplasty may be required for non-responsive cases. Any topic suggestion, comment me down below.